Good day, fellow learners. Once again, this is your mentor, your fact-check buddy, Ray Gapuz, joining you from room 203, second floor of the Ray Gapuz System building here at the United Nations Avenue, Manila. So at this point in time, I'd like to share with you some important hints in order for you to pass the next generation NCLEX in the easiest way possible. Okay, so let's begin. So this is actually pointers number 7. But before that, I'd like to ask you this question. Is the Pearson Vue trick accurate? A lot of people have been taking the standard NCLEX before the next generation NCLEX. We're saying, yes, it is. But is it accurate for the next generation nclex-rn? That's an interesting question to ask. And let me answer it through an experience we just had very, very recently. How recent? Just yesterday and last night. Okay, so here we go. When one of our mentors, who also is our faculty coordinator for the nurse licensure exam, Ms. McLean, took the NCLEX a couple of days back. And then we were waiting for the results. And I asked our document processing officer, Miss Diana Estrada, to try the Pearson Vue trick. And I said, you please do try to apply for Miss McLean on Pearson Vue, and let's see if it will be accepted. And Miss Diana said, noted, sir. And then she sent me a screenshot and she said, it's being accepted, sir. So what is the implication? If your reapplication is being accepted, it could simply mean that you potentially failed the test. And I just said, oh, okay, noted. But at 11:11 p.m. last night, Miss Diana actually sent me another screenshot and she says, sir, she passed the test. I'm so happy. Therefore, even if the reapplication was initially accepted by Pearson Vue immediately, a couple of days, 2 days to be exact, after the test, it does not mean that you failed the test. So stop crying because of that Pearson Vue trick. It is not accurate. So why is it called Pearson Vue trick? Because people refer to it as Pearson Vue trick. So everyone is calling it PVT. Okay? So it is no longer considered as an accurate indicator of a pass or fail status for the nclex-rn. Sigh of relief for those whose reapplication was accepted after they tried the Pearson Vue reapplication trick after taking the test. Okay, so here is her complete experience. Let's watch the short video and potentially react to it. Okay, here we go. So let's react with this short video. Let's go. Miss McLean, our faculty coordinator. Miss McLean, pasok. So Miss McLean just recently had her
Hello,
results.
everyone.
Okay, we'd like to see your face. That's Miss McLean. Okay, now I'd like to ask you this question, Miss McLean. How has your career been as a nurse since you joined the Ray Gapuz system? Okay. So once again, how has your career
Well,
been
sir,
as a
first of
nurse?
all, it was very the experience from well, sir, it has been a very meaningful career since I graduated 2019, and then I took my NLE exam up last 2021, and then after that, you took me under your guide and sponsored my NCLEX examinations from the processing up until I took my exam, which I think 2 years back then from
Because of the pandemic.
2021.
Yes,
Then
because of the
finally
pandemic.
through your help with all the processing, with your scholarship, and you even gave me my master's. Yes, yes, sir. And thank you for giving me as well a full scholarship for my Master of Science in Nursing. It's one of the most prestigious university here in the Philippines. And I can thank you enough for those opportunities that you have given me.
A round of applause. So let's ask her the most important question. So which part of the program helped you the most? What did you do? What programs did you get from the Gapuz system? Because we have a lot of programs. We have comprehensive review. We have boot camp, 10
Looking back,
days. Okay.
yes, sir. So, um, I think most of them know that I am working under the company, so I don't have any time for my comprehensive review. However, as a preparatory for my nclex-rn exam, I had my boot camp last January. And after my boot camp, during my spare time, after working hours, I had the chance to view some of the replay videos from our comprehensive review. And then after that, we had this new technology, which is our core shell, or what we call the RA Gapuz review system core shell, which I had like an access for about more or less a month. And then after that, before my exam, I had my quick fix with you, which is, I think, 60%. I am sure I really love the quick fixer. Think
So
the
if you
quick
are given
fix.
100%, are you saying 60% of your passing the NCLEX is based on your experience with quick fix alone? So how many percent would be the core shell? Now the core shell has QBank, it has video lectures, it's very complete. It has a Pecha Kucha, it has next generation NCLEX pointers and tips, which is being updated and upgraded on a monthly basis. So that's how different it is from the other apps there that just gives you standardized concepts. Okay, therefore, Miss McLean, how many percent will you give to your boot camp? How many percent will you give to your core shell? And how many percent will you give to quick fix?
So to divide it properly, I think my boot camp would be a 10%. Then my core shell would be 30%, and the rest of the 60% would be my quick fix, sir.
Okay, so but let's actually explain to them that it's difficult to cope with quick fix if you did not have your exposure with the boot camp and of course the core shell. So all of these components should be integrated into one holistic preparation to enable you to pass the NCLEX. Okay? So everybody type I'm next, and you can ask Miss McLean questions through our chat box and I will read it to her and ask her. Go, come on. Type I'm next. Those who will type will have a minimum number of items of 85. Those. Okay, so there are three important things there that we can get from the experience of Miss McLean. She had the 10 days boot camp, which I facilitated. That's face-to-face, intensive, from morning till early evening sometimes. Then she had the core shell. That's the latest technology that we have. You have Q banks, you have videos, you have short quizzes, long quizzes, and tips. You have NGN items, and the third one, quick fix, which I also conduct on a monthly basis for 24 hours or 3 days, 8 hours a day. So these three important aspects of our program would usually give us this number of passers worldwide, not including those who do not want their pictures to be posted there. Look, there's no single picture there that's repeated. Each of those pictures are individual pictures. So text or call 0906-201-9383 to inquire, or send us an email at info@ragapuzreview.com. So congratulations to Ms. McLean Luquias, USRN from the Pine City Colleges Batch 2019, Baguio City, okay, for passing the New York Board of Nursing just this month, next generation NCLEX, okay? So here's her email to express her gratitude that was just sent an hour ago. McLean Luquias, it was finally a USRN. It was never easy to pass the nclex-rn. Making the impossible attainable requires a lot of devotion. I agree. This dream would not have been achievable without the assistance of the Ray A. Gapuz review system team, led by mentor extraordinary Sir Ray Gapuz from my NCLEX processing application, ITAPS Gapuz, for your assistance in all my test demands up to my mentoring session. So ITAPS is International Test Applications Processing Services. That's part of the Ray Gapuz system, okay? So you can also have your papers processed through this system. Mom Shans, thank you for your words of encouragement. Mom Shans is one of our senior lecturers. Namaste, Mom Shans. Mom Missy, thank you for always answering my questions. Mom Sol, I appreciate your words of wisdom. Mom Nicole, I discovered a sister in you, our youngest. Hi, Mentor Nicole. And special thanks to my other mentors, Mom Che, Sir Francis. I want to thank Sir Ray for your unending help with everything. No words can ever explain how grateful I am to be one of your students, sharing the same environment as my fellow nurses trying to become USRN. Looking back, the learning environment, the face-to-face bootcamp in Baguio, the RA Gapuz review system course shell and Q banks, which I can use at any time due to work, and of course, the quick fix session with Sir Ray made me feel better prepared for NCLEX. I'd also like to thank my family, friends, co-workers, and review mates for their encouragement. Above all, I want to thank God for this blessing, and I shall be eternally grateful for it. Sincerely, McLean B. Loquias, RN USRN. Salute. Double salute to you, Miss McLean. Okay, now the NGN pointers. What are the things that I want to advise you to focus on, especially those who are taking the test in the next few days? The first one is about hip arthroplasty. Now, what are the things that you have to focus on this? Don't be too technical about memorizing what the surgery would entail, about the things that the doctor should have been telling to the patient. No. Focus on how will you provide post-operative care to the patient, specifically on the instructions which you will tell them on discharge. So discharge instructions. So first and foremost, instruct the patient after hip arthroplasty to always sit upright, okay, at 90-degree angle. So they have to raise their toilet seats. Instruct them not to bend too far forward, which means they should not be tying their shoelaces. They can use shoes with Velcro straps or ask somebody to tie the shoelaces for them. And then instruct them not to cross their legs, whether they're sitting, standing, or lying down. No crossing of legs. Now, another important thing that I'd like you to focus on related to hip arthroplasty would be the potential complication. So if a patient is post hip arthroplasty, there could be a potential for the patient to develop deep vein thrombosis. And there are three factors to consider why a patient post hip arthroplasty is at risk for deep vein thrombosis. One is immobility, second is blood stasis, and third is the thickening of the blood. And this is where your pneumatic compression device should be provided to the patient to prevent DVT. However, remember that if your patient is using the pneumatic compression device for prevention of DVT, instruct them not to wear it when going to the comfort room because it increases the risk for falls. Now, remember, the pneumatic compression device or sequential compression device is used for prevention of DVT. It's not used as a treatment. And once the patient is wearing it, they should wear it continuously. However, if they need to go to the bathroom and they spend more than 2 hours in the bathroom, if they have disconnected the sequential compression device or pneumatic compression device for more than 2 hours, the nurse should need to obtain another doctor's order before it is reapplied. Because definitely, if you've not been wearing it for more than 2 hours, there's increased risk for deep vein thrombosis. Now, the next question that the patient would ask you would be, when can I start to drive? Usually that's after 6 weeks. Remember the 666 rule. 6 weeks after, they can start to drive. And when they enter the car, it should be the butt first and then pivot towards the front. Okay? So butt first, pivot towards the front. Then hold on to the steering wheel. And then your return to work could actually take place after another 6 weeks. So 6 weeks for driving, 6 weeks before the return to work, or sometimes it could extend up to 12 weeks. And of course, the most common concern of the patient, because this is also a physiologic need, when can they return to engage in sex? Usually also after 6 weeks. 6 weeks for driving, 6 weeks for returning to work, 6 weeks also before they can engage in sex. Okay, remember, that's the 666 rule. Okay, so let's move on. The second important thing that I'd like you to focus on would be osteoporosis. Osteoporosis remember, refers to loss of bone density. So you will need to increase calcium in the diet of the patient and definitely to increase vitamin D. Very, very important. And you will have to instruct the patient to avoid foods and drinks or beverages that contain phosphates. Example would be your soda. Why? Your increase in phosphates phosphate, sorry, could definitely decrease the absorption of calcium. Okay, now what do I want you to focus on related to osteoporosis? The risk factors. Okay, so remember the code MENS phase. So MENS, MENS, M, menopause. So after menopause, the patient is at risk for osteoporosis, and then estrogen that's decreased, okay, and then N, nutrition, a decrease in vitamin D and calcium will increase the risk for osteoporosis, so you need to increase vitamin D and calcium. Then S, smoking and alcohol drinking, okay, so that makes your first word MENS. And then FACE, FACE, family history of fracture. So if the parents of the patients have had fractures when they were an elderly, that would be an indicator that the patient is also at risk for trauma or fracture related to osteoporosis. And then advancing age, this is common in the elderly. Caucasians and Asians, they are at risk for osteoporosis simply because for Asians, a lot of Chinese, Koreans, and Japanese are lactose intolerant. And we know for a fact that milk is a good source of calcium. So if they are lactose intolerant, they can't take milk. So definitely their calcium intake would be lesser. And of course, ethnicity. So once again, family history of fractures, that's F, A, age, C, Caucasian and Asian, and then E, ethnicity. So remember, men's face the risk factors for osteoporosis. SATA concept. Let's move on to alendronate or Fosamax. So Fosamax is actually a biphosphonate. It's used in the treatment of osteoporosis as well as your Paget's disease of the bone. Okay, so in Paget's disease of the bone, the most common bone that is affected is the pelvis. What happens? The bones become larger and weaker, and there are two common manifestations of Paget's disease. One is pain, and then two is change in shape. So if your patient is taking alendronate, what are the common side effects? So the patient would experience NDCC. So nausea, diarrhea, constipation. The other C would be cramps or muscle spasm. So NDCC, nausea, diarrhea, constipation, cramps, and muscle spasm. Now, how will you instruct your patient to take your alendronate or Fosamax? Remember, there are some beverages that may potentially decrease the absorption of alendronate. Instruct the patient to take it with plain water or distilled water, never mineral water, because mineral water will decrease the absorption of alendronate by 10%. So therefore, you also need to instruct the client to avoid taking alendronate or Fosamax with tea, coffee, juice, or milk. Do not take it with tea, coffee, juice, or milk. And then the medication must be swallowed whole. Instruct the patient not to chew or crush the medication. Okay, so the second important aspect of your NGN preparation should be the use of technology. So here at the Ray Gapuz system, we have unique learning tools that are based on Gen Z characteristics. Remember, the first Filipino authored nursing test preparation guidebook from Mosby Elsevier was written by yours truly. It's the first Filipino test preparations guidebook that won in the International Book Awards in the US. And of course, my other book for the nclex-rn, nclex-rn in Flash, which is also a finalist in the International Book Awards. It's published by Jones and Bartlett USA. So if you would see the Sounders, and then there's ABC of Passing the NCLEX by Ray Gapuz. I'm so glad to have been given the opportunity to write and create my learning tools for all of you. So this is our latest technology, the Ray Gapuz Core Shell, that covers all the subjects on the test, like safety and infection control, basic care and comfort, health promotion and maintenance, management of care, physiological adaptation, reduction of risk potential, and psychosocial integrity. So all 8 subject areas on the NCLEX are covered. And you can use this anytime, anyway, with unlimited axis. Okay. And of course, the third and the most important, you have to have a conducive environment when you are preparing for your test. So this is the Ray Gapuz NCLEX simulation room, second floor of the Ray Gapuz building here at UN Avenue in Manila. And of course, this is how intimate our classes for our nclex-rn. Now, may I invite you to avail of our next generation nclex-rn Flex, the most flexible test preparation class for the nclex-rn. It's your choice of live face-to-face class, live virtual class, on-demand unlimited video recorded lessons, your QBA plus 3 books, and then your next generation strategies and sample questions plus quick fix session. So you have available schedules for the morning, afternoon sessions only, or the weekend classes only are available. And the fee starts at 3,499. So to avail, give us a call at 0906-201-9383 or send us a message at our email address, info@ragapusreview.com. So once again, this is your mentor, your fact check buddy, Ray Gapuz, saying thank you for your trust to the Ray Gapuz system, and see you in our next video. A functional concept a day keeps your NCLEX RN fears away. Take care and enjoy the rest of the day.